Hey everybody, it's Aaron from Eirinn'sIntel. I just wanted to record a video. I guess today I can talk about another psychology topic, and I was going to talk about childhood disorders or um, some things that children might face when they're diagnosed with either a mental disorder or any kind of child-based problem, I guess. And I've been looking through the DSM a little bit, and I found quite a few things, just, kind of glancing at the titles or glancing at the headings. And interestingly enough, there is autism spectrum disorder, which I don't believe is included in the DSM. And maybe it is. I don't know. But it's called spectrum disorder because it really doesn't have its own, it's kind of like an umbrella term, autism is. Underneath that, you have other things, more specific names to kind of give a name to the specific illness. Like, for example, you have Asperger's, you have just general autism, you have, let's see, what else is there? There's, oh my gosh, I'm drawing a blank. There are other types of autism. The only one I can think of right now is Asperger's syndrome. What I know about autism is that, again, it's an umbrella term, and what happens when a child has autism, and subsequently as they grow older into adulthood, there really isn't a cure for autism. It's kind of like it affects their interpersonal relationships with others in that they don't have the socialization skills that we, as people who don't have autism, would just naturally kind of have. In a way, it's hard for someone with autism to govern his or her behavior around other people because they tend not to feel the same level of empathy that a person without autism would feel for another human being. It's not just about empathy, though. It's about appropriateness in social settings and telling people things they want to hear versus saying just whatever comes to your mind. A person with autism typically does not have a filter. They do not have a filter, so they will just kind of say whatever comes to their mind. And they don't really see anything wrong with this, but that's because they lack the socialization skills to be able to edit themselves, essentially. Like, you may think, oh wow, that lady's really fat, but you wouldn't say it to her face because naturally, that's going to be offensive to that woman, and you don't really want to go around telling people they are fat. I mean, unless that's something you actually believe and you don't like that person very much, and so you don't really mind telling them, hey, you're kind of a fat ass. But a person with autism, especially a child, is not going to realize that, that may not be appropriate, especially in a public setting. So I think what a lot of parents do struggle with when they have a child with autism is trying to reach them and trying to get them to understand, this is what's appropriate in terms of how you govern your behavior in front of others versus what isn't appropriate or what isn't really socially acceptable. And, sometimes there's kind of an emotional coldness with someone with autism because they don't have empathy, they don't have those deep feelings, and oftentimes a person with autism will struggle with showing his or her emotions to another individual. So it may seem as if they have a flat affect, or as if they are just either really bored, angry, or possibly just not present. It may seem as if they are just kind of off in their own little world, and really, in a way, that's what's happening. Now, of course, depending on the level of functioning, you have people who can function at a high level and who can interact with others, especially adults. Because when you've lived with, a disorder for a long time, you do learn how to govern yourself and your behavior, and you learn what things to say and what things not to say. But you still struggle with that disorder, and you still struggle with the diagnosis. Usually, I would say it's received early on, which is why so often autism is seen early in children, because that's when the signs will develop, or I should say that's when the symptoms begin to show, and it's quite simple to make a diagnosis of autism spectrum disorder. It's another thing, it's more complex to actually go beyond the ASD diagnosis and actually pick a name for it, which is, again, why there's that umbrella term. And, there are adults today that do have autism, and sometimes they can be, quote, on the spectrum, which really just means they may or may not fit the autism spectrum diagnosis. However, maybe they were never formally diagnosed. So if they struggle with social interaction, they struggle with emotional feelings and expressing themselves to others in an emotional way, they also may struggle with close relationships, like even with their parents or loved ones or aunts and uncles. They may not really want to be touched. They may not want to be close to someone within like a normal space of, say, about 2 feet that anybody in general might do if they're talking to somebody. They may purposely put themselves outside of the social sphere because they don't see themselves as part of it, and they may keep to themselves. And also, somebody with autism tends to have a higher intelligence. I won't give numbers because, I don't want to shoot myself in the foot. Some may argue that that is not true. However, it is, from what I've seen, people that I've known and observed that do have autism or may be on the spectrum always seem to be very conscientious with their studies. They seem to be very smart, quite introverted, really, because they're in their own world, and they just do their thing. They do their studies, they get their A's. They're fantastic students if they're able to function on that level. If not, they may not pursue school, or they may be homeschooled, in fact, and stay out of the public realm purposely because their parent or guardian may determine, okay, this is really hard for my child to do because his or her autism affects, their skill. And so what I'm going to do is take them out of the public setting and put them into, their own private school setting. And in that case, too, it's possible to reach the child easier because they may be comfortable with their parent or guardian and not so comfortable with others that are strangers. Anyway, that's, I guess, a